Right now, we are checking in with the Park City Hospital. We are speaking with Administrator and CEO Lori Weston. Lori, thanks for joining us this morning.
Hey, thank you for having me.
So I'd love
Happy
to
to be
hear
here.
how things are going at the hospital, just kind of the check-in of how the staff is doing, how the patient load is, just where you're at right now.
Staff is doing well, and we're seeing lower volumes right now, and which is good, which is a good thing. We actually just finished our mobile testing in Summit County. As you know, we've been a hot spot here in the state, and so with expanded testing available, Intermountain has been working with the Summit County Health Department, People's Health Department, to expand testing services to those that live in Summit County that are either asymptomatic or showing symptoms, for us to be able to really figure out where the spread is. And we were at 4 locations over this past week at Park City High School, Ecker Hill, and also in Colville and Camas. And it was a huge success getting that testing done so we can have the information available for the county to make some informed decision on stabilization, how we maybe loosen some restrictions. I know people are antsy to get back to work, get back to some of the activities that they enjoy, and this will be a really great step for us to be able to do that.
And do you have any initial findings of how many people are tested, the percentage of people positive, negative? Do you know any of that as of right now?
I don't. I'm still waiting to see how many tests we actually did and what those results were. We are seeing, just from what we're seeing in the hospital with the lower volumes of positive cases, I'm assuming it's going to be low. We've done a great job in Park City about social distancing, staying at home, and following those restrictions. And so we're hoping to see great results with this information.
Yes, that mobile testing was very successful. We saw many people utilizing this testing opportunity. Was it difficult to find staffing for that? I know that was a huge undertaking to partake in, to have to get all of these mobile testing sites up and running very quickly and have them be efficient and safe. So how did that all come together?
Yeah, it was a really big undertaking. And actually, we have a great team here at Park City Hospital and within the Intermountain system. We were able to pull people together to get set up at each of those locations. We had 4 to 5 stations that were doing testing on those days. Our nurses from our ORs and our med-surg units, ICU, they were all out there helping. We had a great crew, and so we were able to get those up and run. Worked through some bugs on the first day, but we got through them, and we were able to run very efficiently over those 4 days.
Well, that's something else that I have heard, that the staffing was very well done. It was smooth. It was, people expected to wait, but it wasn't excessive wait. They felt protected and cared for, and the staff really put in a lot of extra time to make sure it was a positive experience in the rain and the snow and all the weather conditions that come with spring. So we really want to thank Intermountain and their staff for taking care of this and providing our county with this opportunity to get more testing done to gauge where we're at.
Thank you. Yeah, no, they did a fantastic job. Summit County is very lucky to have the caregivers that they do have at this hospital. They care about what they're doing. They want to help people, and this is what we're here for.
Now, Intermountain also announced that they are resuming some surgical procedures. Walk us through that.
Yes, with the governor's announcement that we can resume some elective procedures, we are looking at this. We're looking to start this next week here at Park City Hospital. We're being very cautious about how we start surgery and who is selected for surgery. Of course, those that are very low risk, we won't be doing any inpatient surgeries. It will be outpatient surgery. So we will be looking through those specific criteria of who will be able to have surgery. I know people have been waiting for a long time, and we want to be able to get people in and get people taken care of. We will have everyone tested prior to surgery, so they will be tested for the coronavirus a couple days prior to surgery to make sure that they're healthy and that they're safe. We will have our restrictions in place as well, our visitor restrictions. So we'll be making sure we're following those social distancing guidelines as well, only letting one person in at a time, not in the same area. So it'll be a lot lower volume than we've normally done in surgery here, but we'll make sure that people are safe, and we start to take care of those in the community that need to be having these procedures done.
Now, this has affected many individuals here within our community. So all of those patients who had surgical procedures put off because of the virus, should they wait for you to contact them? Should they reach out to their doctor, to the hospital? What's that process?
I think it will go both ways. I'm sure that they've already been calling their physician offices on when they can get their surgery done. But yes, if you're waiting to have a surgery, please contact your physician and see if you meet the criteria to get in, and we'll get you taken care of.
And Lori, I'm curious, how are you doing personally? How has this affected your position and your job? How long have you been with the hospital? And really, what is your takeaway at this point with this?
I'm doing great. You know, if I didn't have the team that I did to support me and everything that we're doing right now, I couldn't do it. I've been with Intermountain for 18 years. I've been in Park City. It'll be 9 years this year. And I've been in this position as CEO for 2 years. And I am doing a totally different job than what I was hired to do. So I think everybody is doing what they can during this time. And like I said, it's the people I work with and the community I live in that makes it worth the time and effort that I'm putting into it right now.
Well, everyone coming together to serve, medical staff, everyone at the Park City Hospital and beyond, there are heroes right now. They're taking care of our community, and we cannot express our thanks sufficiently enough. So Lori, thanks for joining us this morning. We appreciate you checking in and keeping us updated on everything happening at the hospital. If there's anything we can do, please let us know. But thank you for joining us here on Mountain Connections. We're going to take a quick break. We'll be back with more right after this.